Hey everybody, it's Dr. Joe and Sleepy Bear, and today I'm going to show you 5 hip osteoarthritis exercises you can do seated. So let's get started. Disclaimer alert, disclaimer alert. So before we get started, if you haven't already, make sure and click on the subscribe button down there because it helps my channel grow. So these exercises can all be done seated for your hip osteoarthritis. The first one is just going to be a simple seated hip flexion. It's just kind of how it sounds, but you want to make sure and keep your back upright and not lean back into it. So if you need a chair with a back to help support your back, that's fine. All you're going to do is just bring your knee up towards the ceiling, getting that hip flexion. You can alternate sides if you want to, going back and forth, or you can just work one side and then stop and work the other side. But again, so you're not leaning back to bring that knee up. You're really just going straight up, trying to keep your back as straight as you comfortably can. After you go into that, we're going to do a long arc quad or a knee extension. And even though it's technically for the knee, the muscles that are getting worked go up into your hip as well. So you really want to work these as well. So with a long arc quad or that knee extension is kind of, again, just how it sounds. You're kicking back or kicking up, excuse me, and straightening out your knee and then slowly coming back down. So this looks easy, but again, if you're doing it correctly, if you're not leaning back into it, if you need that chair, make sure and use your chair. But when you come up, pull your toes and give that extra squeeze to activate that quad and then slowly come back down. So it's not this. If you do this, it's going to be easy and you can do them all day. You really want to go slow and controlled, get that squeeze at the end, and then nice and slow come down. You might have even seen my leg shake just a little bit. So it doesn't take a lot. You don't have to use a whole lot of weight. You just have to control the motion. Same thing, if you want to alternate back and forth, you can. Or if you want to do all of them that you're going to do on one side and then switch and do all of them on the other side, you can do that as well. So the next one is going to work your inner muscles, those adductor muscles. You can use a ball, you can use a pillow, you can fold up a pillow if you don't have a ball. You can use a yoga block, those work really well. But you want it to be something that's gonna keep your hips about hip, or your knees about hip width apart. So you don't want it to be or something really small, you don't want it to be something really big. You want it to be so you're kind of almost in that neutral position. And then all you're gonna do is squeeze in to the ball, and you should feel that on the inside of your thighs, and hold that for about 3 to 5 seconds and then relax. So again, you might have to shift it around a little bit so that ball doesn't slide out, or you can just hold it and then squeeze in. When you're first doing these, this is kind of what we would call an isometric exercise where you're activating the muscle but not really moving it. So just start off with a little bit, maybe even only 50% of what you can do, because you don't want to go all out and then end up getting yourself sore. So I always tell people to start with a little bit and then progress their way up. So again, holding that for about 3 to 5 seconds and then relaxing. So the next one is going to be a hip rollout. So you're using the muscles on the outside of those abductors. Now, you can use a band if you want to get more resistance, but I would say starting off, probably don't use a band. But I'll show you at the end the way you can do it with the band if doing a rollout is too easy for you. So keeping your knees about hip width apart to start off with so you can come all the way in is a good way, so you'll get that extra movement. But you're just going to roll out, keeping this one in one spot and then rolling back in. So you can either stop here, or if you want that little bit more movement, then you can roll all the way in. So rolling out and then coming in. You can roll your foot out too. Sometimes people ask me, do you keep your foot down the whole time? Sometimes I do, but if I want that extra motion, if I'm feeling good in that hip, you can lift up your foot to roll it all the way out, and I'll feel that extra stretch in there, and then rolling it back in. Again, go slow and controlled. That's where you're going to feel the exercise. If you're going fast, you're not really going to feel it. If you want more resistance, and this will make it a lot tougher because you not only have to roll here, but you're stabilizing here. So same movement, but this time you try and keep this leg here and then you're rolling out. So this time you're actually working both legs. So you're working them in different ways. I'm rolling out this way, but I'm stabilizing the one that's not moving. And so again, this looks easy while I'm doing it, but it's a lot tougher than it actually is. So make sure you're going slow. If you use a band, start off with the lightest one. So then the last one is going to be where you're putting it around your feet. So now you're going to get that internal rotation of your hip. And so when you're doing the internal rotation, you're actually bringing your foot out, but you're not bringing your whole leg out. You're keeping your knee in about the same spot, and you're just turning it out here. So I can feel that a lot in my hip area. So again, this is one that if you're not quite ready to use the band, that's fine. You can do it without the band and just kind of turn your foot out and come back in for that hip internal rotation. But when you're ready, you can put that band in there and then come out and back in. If this is a little bit tough, you can put your foot down and then come back in, but eventually you want to keep that foot up the whole time so you're getting that resistance the whole time. So there you have it. Those were 5 hip osteoarthritis exercises you can do seated. If you'd like to help support my channel, make sure and click on the link up there, and don't forget to subscribe. Where? Yeah, down there. And remember, be safe, have fun, and I hope you feel better soon.